There are some training sessions that you may be participating in or would like to know about, and those have to do with adult and teens. And we want to welcome you to WJTS in.form to find out more about those trainings. I'm Bill Potter. Joining me here in the studio is Donna Oeding. Donna is the director of the Dubois County Health Department, and also joining us is Janet Schnell, who is, Janet, actually you're like a member of many different committees, aren't you?
Yes.
But you're an expert in many different areas?
Yeah, I'd like to think so, yes.
Okay. Well, you two are here as part of the Dubois County Health Partnership.
Correct.
Could one of you explain what that is?
The Dubois County Health Partners, Public Health Partnership is a group of just different agencies, service organizations, some of our employers, all of the schools, the hospital, the health department, all partner together, and we try to address what we believe are the biggest health issues facing Dubois County. One of the issues that we have identified is mental health issues for Dubois County. And so this program touches at the heart of that, and we are thrilled that we can bring it to Dubois County.
And am I correct in saying that these are trainings?
Absolutely.
Okay, who are the trainings for?
People in the community.
Okay, so
Adults.
It could be me, it could be anybody. It's not like I have to be a health professional.
Correct. Anyone who's over the age of 18 is more than welcome to attend the training, and it's for everyone in Dubois County and around Dubois County.
Okay, now the training is called Mental Health First Aid. And you have two trainings, one for adults and one for teens. But when we say for adults and for teens, we're not necessarily looking for that age group to come to these trainings. This is for trainings for people who would deal with that.
Correct.
I
Correct.
think I'm trying to dig
Yeah.
myself into a hole.
Yeah.
Can you get me out, Janet?
Basically what it is that we will have emphasis upon certain age groups. So the adult training will be the emphasis upon what we look for with the adult population, and then the teen will be what we look for with the teen population. So the focus will be upon that age group.
And registration for this training is ongoing right now, and it's really not a deadline as much as there is a limited number that can attend.
Correct.
How do they register if someone hasn't?
The registration forms have been sent out a multitude of ways, but if for some reason you're interested in attending the mental health first aid course, you can get a hold of either Janet or I. Will be happy to send it back out, or really anybody that is a member of the partnership has received the registration forms. Okay. We should let you know that the program is going to be on September 18th. It is an all-day program. It'll start at 9 a.m. It'll last till 5 p.m. It's going to be out of VUJ. There will be a $6 lunch provided. You'll just pay for that on the day of the training because it is a full day of training. So we're real excited that Janie Chappell from Deaconess Cross Point will be coming in to do the training for us.
Is it possible somebody could show up that day and register, or probably not? You're probably going to fill up ahead of time?
We will definitely fill up because we have had a lot of interest, especially for this first training.
So folks need to contact you as soon as possible.
Correct.
Okay. Now, you took the training, Janet, in July of about a year ago.
Right.
What happens?
It's a really good informational piece. We all had gotten a book that covers different areas: depression, anxiety, psychosis, substance abuse disorders, eating disorders. And what you do is you look at how to address these using an ALGE method, which stands for assess, listen, give reassurance, encourage professional help, and encourage self-help. So each chapter will have where you then reassess and go back to using the ALGE system once you've gotten the information about what does depression mean.
And so you have an adult session, which means how to recognize these things and how to deal with these things pertaining to adults. But then a special training coming up in, I think, November.
Correct.
That deals with how to deal with that with teens. You're not looking for teens to go, but you're looking for folks that have to deal with teens.
And we have talked about with some of the teens too that it would be nice to have, especially the younger generation, because we do know that teens talk to each other. So the first line of defense is going to be a teen talking to another teen, so that they know what resources that they will have with the adult population. So again, when we're saying teens, it's 18 years and older.
Okay, and this training really is for anybody. Is this a way to get people to recognize problems before they become big problems, or is this a way for people to take care of big problems? Or is it both?
I think it can be a little bit of both. Really what we're trying to do is create awareness, because people need to understand that there is mental illness out there, and that you don't have to have the worst form of mental illness for it to be an issue. And we're trying to reduce the stigmas concerning mental health, to know that it is okay to go to your friend and say, I'm having issues, or for your friend to come to you and say, I think you're having issues. Why don't we try to get you some help? You know, that's what this is all about, to recognize those signs and symptoms and say, you know, it's okay, I need to get help, or I need to get my friend help.
Yeah, Janet, we've talked about that before. Sometimes you just really need to just ask, can you help, or something doesn't seem right, you do need to get help.
Well, and I think that we need to recognize that people aren't really comfortable talking about mental health issues. We know it occurs. We know that it's not based upon race or your income level. Everyone is affected somehow, either personally or with someone in your family. So what this course does, it helps you become more comfortable talking about it, knowing the research information that's out there, the causes and concerns. As a coordinator for the Dubois County Substance Abuse Council, we know what substances are doing to people's bodies, especially with the newest things that are coming out. Some of the synthetic things are really causing a lot of problems with the mental health. And so this course will help understand what's going on, not only in Indiana, but in Dubois County, where our highest occurrence is. But even for people to understand that if they find certain packets of synthetic whatever, marijuana, that it is so much more dangerous, and that it does affect the mental health. And so that's what this course not only talks about, the mental health aspect, but also what does substance abuse do to the mental health.
But it's so much easier to look the other way. But that's why these programs are important, to teach you, instead of looking away, and I think we look away because we don't know how to handle it, this will give you the ammunition you need to be able to fight that battle with somebody that may have mental health. What is the first aid? What are some things that you can do? What will be taught?
The very first part will be how to assess, how to know if someone really does have a problem in a mental health area. So it's going to be looking at what the some of the signs, symptoms are. And so from there, you have to be able to have that tool bag. To even start would be the first part, would be the assessment, is to understand, and just and not as a mental health provider, but as a person coming in off the street where you're worried about someone. Should you be worried, and where should you at that point decide that maybe they need to have more professional help?
What are some things that you can look for? What are some signs? Now, this is not the training. We want you to know that. But
Yeah.
you know, what are some things that people go, oh, you know what? I think I've seen things like that. I should go to this training.
Right. When it comes to things like suicide, the thing that we know to look for are things in changes in eating habits. If they're eating more or eating less, a big area is a change in sleeping habits. If you're normally getting 8 hours of sleep and all of a sudden you're going to 12 hours or to 4 hours, it's what is the exact opposite of the person's normal behavior. Withdrawal, if they are no longer a part of the church community, we do a lot of the trainings with the church. And so if they're no longer a part of the church community, or if they're not coming into work, drop in job performance, drop in school performance, we notice with grades. So there are a variety of different areas when we talk about the mental health. When it comes to substance abuse, though, it's the change in behavior. It's all of a sudden becoming this very withdrawn person who then all of a sudden is consuming, in Dubois County it's alcohol, is still our number one problem. All of a sudden they need to have that drink to unwind, or they need to have that drink to become very jovial. But it's when it becomes a daily use, when it affects their daily function. That's when it's a problem.
Well, you have a note here that there's binge drinking in 12th grade seniors.
Right.
That's a big problem.
In the state of Indiana, the Indiana Criminal Justice Institute asked for all the counties to do an assessment with grades 9 through 12. And we work with Leah Tooley, who's also on the partnership, and we're looking at what's happening here in Dubois County. And what we've noticed over the years is that there is a steady increase from the grades 9 up to the 12th grade with binge drinking, where it's the highest is at the 12th grade level, where there's a lot more binge drinking, and we're above not only the national average, but the state of Indiana average also.
And prescription drugs seem to be the new thing that we're noticing.
Right, right.
And that can be adults or teens.
Absolutely. Increase in opiate use, and that's the pain prescription medication. And so, yeah, we know that there's a problem, and That's part of this training, is how do we address that problem.
Okay, so how will the training go? We all get these books, and then we sit down like in a classroom, and people are just telling us things in the book to look for. The book, do you get to keep the book then?
You get to keep the book.
So you have a way of referencing.
Sure.
Okay.
It's a nice, we have a nice book that we go back to, but it goes with the chapter descriptions. And Janie and actually Kent Leslie is the other person who does the training. It's in the VUJC lecture hall, so we'll all be facing them, but they do a breakdown with each session, and they'll do the informational piece, and then they do a dialogue back and forth where they'll go back again to that algae. What do we do with that acronym? How do we assess? How do we listen? How do we give reassurance? How do we encourage professional help? And how also do we encourage self-help?
Okay, so it's mental health first aid training coming up for adults on September 18th.
Right.
And for teen training, meaning training anybody how to deal with teens and what they're going through, November 7th. And registrations are now being taken, but you only have room for 40 people. Is that right? So
That is
you
correct.
need to register now. And how can they register again?
Again, if you did not get a form via email or through any contacts, you might know, you can easily call me at the health department at 481-7050. I'll be happy to get a registration form to you. Or I'm sure if you contact Janet or anybody else that is on the partnership, and that's a big group of people out there, they will have the registration form as well. So, but don't hesitate to call. We want employers to come. We want school people to come. We want moms and dads to come. This is really just important overall knowledge for everyone to have.
Okay, and the only fee is $6 for lunch, but you're going to eat lunch anyway.
It's
pretty
a
reasonable.
great deal.
Yes.
It's a great deal for this kind of a training that we are getting it at no cost. So we're real excited about that.
And ladies, anything you'd like to add?
I think that's it.
Yeah.
Thanks to both of you for the good work that you do. And remember, this training is coming up in September and November for adults and for teens. So you may want to participate by contacting one of them. But you better do so soon because they're going to fill up. They're limited on the number of people. Thank you for watching WJTS in.form. We are local people watching local people.